Now, we've spoken a lot about fevers and viruses, but really the key to managing children at home is monitoring their hydration. Now, why do children become dehydrated? Any illness, such as gastro or any virus, can make children either lose fluid or not drink as much. That's often the most common reason for dehydration. Other things like excessive exercise or not drinking enough on a hot day can also cause dehydration. Dehydration is important because the body needs fluid to run. And without the fluid, children can become very tired and lethargic, but also the most concerning thing for us is that it can affect the kidneys. So it's really important to keep on top of hydration. So what are some signs that your child could be becoming dehydrated? For me, the key is to think about the urine. So dark or very smelly urine can be a sign of dehydration if they're weeing less than usual. So with babies, it's usually about less than half of their normal wet nappies, or with older children, going to wee about less than half of normal. They can sometimes look quite dry as well, so dry lips and dry tongue. Signs of severe dehydration is usually if the child is quite pale, very lethargic, so sleeping all day long. Now remember, we expect kids to be a little bit more tired than usual when they're unwell, but they should still have periods of waking up and being active, or at least be interested in drinking. But if they're so lethargic they're not doing any of those things, then we worry about dehydration. And also, with severe dehydration, children can become cool and have cool hands and feet. Now, what can you do at home if your child is starting to become dehydrated? So particularly if they've got a viral illness, they're not drinking as much, or if they're losing a lot of fluid with vomiting and diarrhea. The most important thing is to give as much fluid as possible. Now, the key to giving the fluid is to give small amounts often. The problem with giving a lot of fluid at once, it can make the child feel more unwell, or they may just refuse it altogether. So offering lots and lots of frequent sips of fluid can be much more helpful. Particularly hydration fluids that you can get from the chemist can be very helpful, especially if your child is losing fluid. So if they've got vomiting or diarrhea, they're losing very important electrolytes. So replacing that with electrolyte hydration fluid can be really helpful. Or you can try other things like icy poles or other foods with fluids such as soups or grapes that have a lot of fluid in it. So anything that you think your child might be able to eat or drink that has some fluid in it can be helpful. The other thing is with babies, the main thing is, again, short, frequent feeds. So that may be offering breastfeeds more often, but for a shorter period of time. If your child is bottle fed, popping some hydration fluid in there as well can help. The main thing to note with babies though is that they can become dehydrated much quicker than older children. So if your child is less than 6 months and you're worried about dehydration, I would suggest seeing a doctor. When would I recommend seeing someone for dehydration? As mentioned, if your child is less than 6 months of age and you're worried about dehydration, I'd definitely see a doctor then. If you're worried about them dropping their urine output, so if they're making less wet nappies than normal, generally less than half is a good sign that they need to be seen. If you're worried about them being lethargic or the reason why they are dehydrated, if that is concerning you, that's a good time to be seen. Now, what can we do to treat dehydration? If your child ends up in hospital in the emergency department, often we will trial some fluids. So that could be giving them medication to stop vomiting if they're vomiting, and then see how they go once their pain is under control and see if they can tolerate fluids that way. Occasionally, we need to pop a little tube in the nose that goes into the stomach, and that way we can give them some fluid straight into the stomach. That's mostly for younger children, sort of 1 to 2 years, less than 2 years of age. Occasionally we'll bring children into hospital and pop a drip in and we can give them fluid that way. So it really depends on how dehydrated the child is and how likely it is to continue. But some of these steps might help you manage the dehydration at home so you can avoid a trip to the hospital.